happy today to have Dr. Jonathan Patz with us. Dr. Patz is professor in the John P. Holton Chair of Health and the Environment at the University of Wisconsin-Madison. His faculty appointments are in the Nelson Institute for Environmental Studies in the Department of Population Health Sciences. He also directs the university's Global Health Institute. Dr. Patz co-chaired the health report for the first congressionally mandated U.S. National Assessment on Climate Change, and for 15 years, he has served as a lead author for the United Nations Intergovernmental Panel on Climate Change, or IPCC, as you all are familiar with now, the organization that shared the 2007 Nobel Peace Prize. Some of his other awards include an Aldo Leopold Leadership Fellows Award, a Shared Zayed International Prize for the Environment, a Fulbright Scholarship, and the American Public Health Association's Homer Calver Award for Environmental Health Leadership. He's a member of the National Academy of Medicine. Dr. Patz, thank you so much for being here today, and I'm going to turn it over to you.
Okay, it's a pleasure to be here. Thanks for the invitation. Of course, I have no financial conflicts. Put that slide up. So let's get rolling here. I'm going to be talking about the health benefits from climate change mitigation. You've all learned about the health risks from climate change, and now I'm going to talk about the benefits from climate action. And if you think about what we need to do to reduce greenhouse gas emissions to keep the Earth from warming too much, you can see that from this is from the Paris Agreement, from Conference of the Parties, 21st Conference of the Parties in 2015, that if we do no action and we don't curb our fossil fuel emissions, we're going to be heating the planet substantially, the blue line here. And all of the countries that came into the Paris Agreement came in with these intended nationally determined commitments, these INDCs, that would be substantial, like the EU saying they'd reduce emissions by 40% by the year 2030. The US came in at 28%. Other countries came in even higher. So big commitments to reduce greenhouse gas emissions. But even with those big commitments, we're still going to be committed to a fair amount of warming. And of course, as you know already from the climate science and the impacts on climate change that have been done over the years through the IPCC, we want to stay below 2 degrees centigrade warming before ecosystems collapse, food systems collapse, and we have really big problems. So we're trying to stay below that level of warming. So what does it mean to, we really need to ratchet up success. We need to go beyond those big commitments from the Paris Agreement and even go further. Well, how do we do that? How do we get immediate and substantial action? Well, it's a good thing that you're taking this class, because the answer, I think, is by understanding climate change through the lens of health. Through a health frame, we recognize that we can move things quite quickly when we understand that our health is at stake. A perfect example is the current pandemic that we're in. Look how quickly we have mobilized and shut down the global economy. And I'm going to show you in the beginning and at the end of this talk that, in fact, preventing the next pandemic, it's about the environment. Focusing on climate change and conservation will help us prevent the next pandemic. But, as I mentioned, shutting down the world economy, that's not painless. And one of my big concerns, and this was written up in the New Yorker, in the New Yorker a couple of weeks ago, will people fear the trade-offs of solving yet another global crisis, as our global economy is just going through the floor with this current pandemic? Are people going to say, wait a minute, we can't risk that. We can't do anything on climate change because it's going to just kill our economy like the pandemic did, right? Well, wrong, at least wrong in my opinion, because unlike COVID-19, I think that combating climate change could be free. even a net gain. And so for the last 6 or 7 years, I've been writing about climate change challenges and opportunities for global health. Solving the global climate crisis may be the greatest health opportunity of our times. And just last month with 2 former students, we put a piece in JAMA, a low carbon future could improve global health and achieve economic benefits. So this lecture really is not about the risks of climate change, which you've all been learning already, but about the health opportunities from a low carbon society. And this is pretty urgent. From the Paris Agreement of 2015, the leaders of the world asked the Intergovernmental Panel on Climate Change to tell them what would it take to stabilize warming of the Earth less than 2 degrees. But in fact, in Paris, people were saying it would be nice if we can stay below 1.5 degrees average warming of the Earth because of all the reasons that we know warming affects us. So the IPCC published this report 3 years after Paris, and they concluded that to stabilize the world at 1.5 degrees centigrade, we'd have to cut emissions, primarily burning fossil fuels. We have to cut emissions from burning fossil fuels, but also reduce deforestation because that's part of the problem. We have to cut these emissions by 45% by the year 2030, so 10 years from now, and be at net carbon zero by 2050. And this report is what really woke up the world. And of course, you know, the youth movement, Fridays for the Future, Greta Thunberg, you know, this is where the children are saying, this is serious, this is an emergency, this is our future, and we need to really get moving and quit talking about it and really do something. So I would posit that there are 3 main sectors where if we reduce our fossil fuel emissions and consumption of energy, we can have enormous health opportunities. The first one is the energy sector, and I'm going to be talking a lot about the energy sector today. You all know that air pollution is dangerous. According to the World Health Organization, 7 million people die prematurely from air pollution. And the other sector I want to talk about is the food sector, and that, you know, a high meat diet and unhealthy food systems are really damaging for the environment, but also damaging for our cardiovascular system. The third big sector is transportation. And I have this grayed out a bit because I'm barely going to talk about this sector because Dr. Hallie Frumpkin, a brilliant scientist and leader, has talked already about the built environment and providing a healthy human habitat in the urban setting. So I'll only touch on that a little bit because Dr. Frumpkin already covered that sector. So this is the breakdown as far as air pollution, according to the World Health Organization, indoor and outdoor air pollution, a little bit of overlap there, but essentially 7 million people dying every year. So let's go to the city of Atlanta, Georgia, okay? This is a course in Emory, so may as well start with Atlanta. This was a natural experiment during the Olympics. Atlanta has a lot of pollution from traffic, and the mayor had some measures put into place to make the Summer Olympics of 1996 cleaner for the athletes. So there were traffic rules, and actually traffic fell by 23%. And not surprisingly, air pollution dropped, and ground level ozone levels fell by 28%. What happened? Well, asthma-related ER visits by children fell by 42%. And of course, these are smart epidemiologists, and they're looking for confounding factors. They looked at, they wanted to know, well, maybe less people are driving to the emergency room, but they found ER visits for non-asthma did not change. So in this controlled study, they found a very direct relationship between traffic, air pollution, and asthma. Not rocket science. We know how harmful air pollution is. And in subsequent Olympics in Beijing, they did the same thing. They reduced industry, and I don't have the health outcomes, but you can see improved air quality across the board. So what will it cost to get to clean energy? You can see that this is an estimate, global average, from a study by Jason West et al. In 2013, looking at the investment cost of clean energy to get off of oil and coal. You know, it might cost some money, like about $30 to avoid emitting 1 ton of CO2. But when we burn coal and oil, which produces greenhouse gases, CO2 being the most abundant greenhouse gas, what else do we emit when we burn coal? We emit hazardous pollutants like fine particles, PM 2.5, nitrogen dioxide, sulfur dioxide. So when you avoid emitting 1 ton of CO2, you also avoid those hazardous pollutants. And if you just looked at the reduction in PM 2.5, the benefit, the average global benefit from avoided mortality, hospitalization, and lost workdays is on average $200 for every ton of CO2 avoided. And I like to ask policymakers a really tough question, you know, which number is bigger? Because they're all focused on the cost of energy, of clean energy, and they're forgetting how much bigger the health benefit is to that air quality, that improved air quality. And if you live in other parts of the world, like in India and other polluted areas in Southeast Asia, your health benefit can be even that much greater. As far as the $30 per ton, though, I question that, because if you look at the price of solar, it has dropped precipitously since the 1970s. It's dropped 99% in price. And very recently, solar and wind have dropped 80% and 30% respectively in the last 7 years. And for the first time ever, a report coming out of the International Renewable Energy Agency that in 2018, renewable energy plus batteries is the cheapest way to generate electricity, first time ever. So the price of solar and wind, and especially solar, has dropped just unbelievably fast. So fast that a colleague of mine, Professor Greg Nemeth, who's an expert in energy policy, wrote a book, just published a book this year on the surprising reason why solar has dropped way faster than anyone predicted. Now, post-COVID, you know, with oil in, you know, the price of oil in negative territory, that's pretty strange, and I don't know what's going to happen over the next year. Frankly, it's a time to divest from oil, and it's a great opportunity to invest in renewables now. But let's take a deeper dive into studies that show health benefits from getting to a low carbon economy. This is out of MIT, a study looking at air quality from low carbon planning. There are a lot of details in what a low carbon economy looks like in this study out of Nature. But the bottom line out of the abstract, I just pulled the key thing for us is that the health benefits stemming from that cleaner air could offset the investment cost of clean energy, anywhere between a quarter to tenfold, 26 to 1,000%. The value of health benefits offsets the investment cost. Looking at the United States, this is a map of where we get energy from coal, natural gas, nuclear, hydro, wind, solar, and oil, and other. Notice that in the Ohio River Valley, all those big black circles, that indicates lots of coal-fired power plants. And if you look at the air pollution coming from electricity, this is a map showing that the Mid-Atlantic and Ohio Valley, you know, those areas are very much affected by coal-fired power plant pollution, and the deaths, the rates of mortality because of that air pollution. A recent study looked at the United States, asking the question about renewable portfolio standards. You know, many states are required to have a certain percent of their energy coming from renewables. You can see here on the left, if you're required to have 13% of your energy coming from renewables, there's a cost to that. You know, the cost is falling, as I mentioned, the price of solar, but still, you know, to switch energy systems, there's a cost to it. The gray is looking at down the road climate change benefits, reduce climate emissions, but look at the largest bar is in health benefits. So again, cleaner energy gives you, just from 13% renewables, a higher return from saving lives and morbidity. If you double that to 26%, sure, there's an increased investment cost, but look at the much higher return on health benefits. And putting a price on carbon even higher, this is a very complicated story though, and we need to price carbon fairly, and this is something that's going to take some real planning from economists and social scientists to do this right. But just like we put a price on tobacco, and that dropped the smoking rates in teenagers, we are going to need to get to a price in carbon, but we need to do it fairly so we don't get a backlash from the poor people being disadvantaged and getting riots like what happened in Paris. And you can see, you know, the health financial gain per CO2, per ton of CO2 reduced. So there is an argument that if you get off of fossil fuel, you're going to lose people are going to lose jobs. And from a health perspective, you know, that's not good. If it's not good for their health. But I want to quote from you findings from the U.S. Energy and Employment Report. This is a federal government report. This came out in January of 2017. There are 1 million U.S. jobs in renewable energy. That's 5 times more employment compared to jobs in coal, oil, and gas for energy combined. And jobs and income are a health issue. So when you hear this story about losing jobs, you know, there are more jobs in renewable energy. So, and I'll show you something else about that in a minute, but you know, it's not, this is a false argument. Some people will lose jobs, and we need to do something about that. But there are more jobs in renewable energy in a low carbon economy. I had a graduate student, Dr. David Abel, look at Wisconsin, the state where I'm in right now. You know, is it feasible to generate electricity from 100% in-state renewable energy? And because we get all of our electricity, most of our electricity from coal and, well, a majority from coal from outside of the state of Wisconsin, which means we are wasting, we're not wasting, but we are shipping money out of the state to pay for dirty power. Can we do it a different way? And the answer is yes, that we can actually produce all of our electricity in state if we were to not change nuclear, which is at only 4%, and go to solar and wind and use conservation measures. We actually can produce all of our electric power in state. And that would create 162,000 net jobs. And the pollution, reduction in pollution, would save so many lives that that you would avoid $21 billion in mortality and health costs. So, you know, we've looked at the numbers for Wisconsin. It's a no-brainer. And if looking at jobs, you know, all these renewable energy jobs are all over the place, but the United States is barely taking advantage of this. You can see that, look at China. They're the ones that are really, you know, investing in this, in clean jobs. This is the president of China talking about the Paris Agreement is a golden opportunity that really needs to be seized upon. And here you can see the world's largest floating solar array in China. Now, China is tricky. You know, they are hedging their bets. They also still burn a lot of coal, but they are the largest investor in renewable energy. And so this is something that we just need to catch up on and try not to fall way behind like they are moving forward. So I did mention, you know, there will be some job loss. And as medical students, soon to be clinicians, we absolutely need to take care of vulnerable populations. And so while I would argue that we absolutely cannot burn any more coal, coal should not be burned for any reason, we need to take care of coal mining communities. You know, they will be vulnerable. And there needs to be substantial, meaningful, you know, real commitment, financial and other commitment to helping coal mining communities. And not token support, real support of coal mining communities, because we cannot burn more coal. And if we talk about a price on carbon, it absolutely needs to be equitable and be structured very strategically so that poor people that, for example, are driving less energy efficient cars, they're not disadvantaged. And of course, we have to get rid of fossil fuel generated cars to begin with. And Dr. Frumpkin talked about that on this past Wednesday, why we need to get off of that type of transportation mode. I want to shift gears now to the food sector. And this is a picture I took during the People's Climate March back in September of 2014. You can see on that cow, I am full of greenhouse gas. Do you have a stake in it? And of course, you know, raising protein, getting protein from red meat is very energy intensive and harmful to the environment. Not to mention too much red meat is not so good for our own health. Looking at greenhouse gas emissions by sector, notice in the orange here that agriculture and forestry, deforestation and land clearing for pastures, rangeland is a problem. It's a quarter of the emissions. So it's a huge component of our current climate change crisis. And so can we change our way of operation? Greenhouse gas emissions not only are about a quarter of emissions for greenhouse gases, but look at what the top 5 meat and dairy companies create as far as emissions, equivalent to ExxonMobil, Shell, or BP. You know, so it's not trivial. And agriculture drives climate change. Primarily, the biggest one, not only the emissions, but also the land use change, especially deforestation, cutting of the Amazon to raise livestock, things like that. And so between the deforestation, land use change, and the greenhouse gas emissions, be it from CO2 emissions, from machinery, and to nitrous oxide emissions, what happens when fertilizers break down, you get nitrous oxide emissions, and also, of course, with livestock, and rice paddies, by the way, emit methane. So those are all big reasons that we need to focus on the agricultural sector as far as a problem, a cause of climate change. And if we think about land use change today, and by today I mean thinking about our current pandemic, land use change is one of the biggest causes of disease emergence. It's also a threat for conservation. It's a major driver of climate change, as I've mentioned. But because of land use change and disrupted habitats, diseases like malaria, Ebola, Hendra and now SARS-CoV-2 that's causing the COVID-19 pandemic, these can all be traced back to disrupted habitats and shifting wildlife, changing, forcing wildlife to move, to migrate, to become more dense. And if you have a denser population, possibly higher prevalence of an infection. We've been talking about this for a while. We published a study 16 years ago talking about unhealthy landscapes to reduce, leading to emerging infectious diseases. So this sort of comes full circle to today's pandemic when you think about agriculture and land use change, and actually that it's part of today's pandemic. And the upstream causal factors include not only human incursion into, but also disruption of nature. And agriculture as a sector is why we have changed the global landscape more than any other reason. Now, of course, there are trade-offs. We need food, right? But the way we are cropping with monocultures and the way we have unsustainable food system right now, we need to really revisit this in a hurry. And this editorial, the title was so appropriate, What the Coronavirus Pandemic Tells Us About Our Relationship with the Natural World. So agriculture, land use, deforestation, part of this problem that led to the current pandemic. Of course, another issue in the food system is that we waste a lot of food. Globally, we waste a third of the food produced, and that's equivalent to a lot of greenhouse gases as far as the percentage. And in the United States, we waste 40% of food. And so food waste, it depends where you are. In a wealthy country, a lot of the food waste is at the back end. The food is produced, it's distributed, and then not eaten. In poorer countries, it's more at the front end, getting the food from the field into the market. So food waste happens in different places depending where you are. And of course, thinking about other greenhouse gases besides the most abundant one, which is CO2, agriculture is the largest contributor to non-CO2 greenhouse gases globally. Methane, for example, has a global warming potential that is somewhere between, I think, of 25 to 30 times that of CO2. So these non-greenhouse gas, these non-CO2 emissions come from agriculture, come from our food system, and they are very potent. Now, on the health side of this, we know, and this is something I'm sure you all know, that if you compare a high meat diet, this is 100 grams per day of meat in the diet, that the equivalent, the environment, this is looking at mean carbon dioxide equivalent per day per kilogram of protein. And of course, a high meat diet is very hard on the environment. Here's a lower meat diet, fish, vegan, vegetarian. So we know that eating lower on the food chain is good for the environment. It's also good for our cardiovascular system. Let me show you a comparison of sources of protein. If you look at the top here is protein from red meat. Notice that you can only eat about less than half of a cow turns into red meat. Look at the feed, the amount of feed required, and the amount of water required, and the land required to get protein from red meat. Pork is a little bit better. Chickens are a little bit better. This is actually insects, looking at crickets. But also you may as well put in legumes and obviously much less environmental impact from these areas. So this is where we have a golden opportunity. If we can get off of a high red meat diet, incredible benefits for the environment as well as for our health. So Dr. Frumkin talked about the urban environment as our natural habitat. So I'm not really going to talk about this much. I'm just going to touch on it briefly because my former postdoc, Dr. Jason Vargo, came up with this wonderful term. We're not Homo sapiens, we are metro sapiens. And as Dr. Frumkin talked about, urban design is so important to our health. And if we look at active travel, for example, cities in the United States with the highest rates of walking and cycling have obesity rates that are 20% lower and diabetes rates that are 23% lower compared with US cities with the lowest rates of walking and cycling. And I just want to point out that cycling and exercise in general is incredible prevention of heart disease, cancer, dementia, and depression, which you all know, right? Well, I want to show you one more slide about this because you're medical students primarily. And I want to, this is by Dr. Pedersen, one of the world's leading experts in physiology, exercise physiology. She's from Copenhagen and she's on, I think, several different national academies. And bottom line is that the benefits of physical activity go far beyond just burning calories. So it's not just about obesity, and of course we know about diabetes, but look at, contracting muscles are factories for beneficial anti-cancer, anti-cardiovascular disease chemicals, and also boosted immune system. And when you think about disease prevention and chronic disease prevention, this is really important. But I guess it's now also important when you think about current pandemic. And I think when we're dealing with current pandemic, when you see a slide like this and you realize how important exercise is to boost the immune system, this is something we ought to be recommending in the COVID world, that exercise is really important for so many reasons. I'll add one slide on green space because I don't think you've had this one yet. It's a new study from the Proceedings of the National Academy of Sciences, published last year, talking about the association between the risk of developing any psychiatric disorder and childhood green space. And notice that these graphs, be it if you're in a rural area or a small town or a suburb or in a big city, wherever you are, and this is from Denmark, your chance of developing a psychiatric disorder anytime in your lifetime has some correlation with how much green space, a negative correlation with the amount of green space that you were exposed to as a child. So again, as we're thinking about designing and thinking about how we can have benefits to health as we reduce the urban heat island effect in cities, as we try to get to green infrastructure, as we try to get to low carbon economy, this is yet another large benefit if we can maintain green space as far as a mental health benefit. So I want to wrap up my lecture and come back full circle to the pandemic. As I mentioned in I think the second slide, that this pandemic, it's about environment at the front end and the back end, that it's about land use change and changing habitats, which has helped promote, well, unfortunately helped promote the spillover event from one species into another that finally got to us with the current pandemic. But this study out of Harvard showed that there's a relationship between air pollution and the risk of dying from COVID-19. And the results are that just 1 microgram per cubic meter of PM 2.5 is associated with a 15% increase in the risk of death from COVID-19. And this was a very well-controlled study looking at controlling for population density, income, you name it. Very well-controlled study showing air pollution matters in this current pandemic. And again, that environmental factors are both at the front end and the back end of this current pandemic. And I'll finally end by showing you something that you have seen for sure. If you've been seeing any news, raise your hand if you have not seen this picture from New Delhi, India. Then I don't see anyone raising their hand. You've all seen this picture, before the pandemic on the left and during this pandemic on the right, shutting down the global economy, which has been disastrous for jobs and for all sorts of things. But, it's not subtle. What could be any clearer comparing today's air quality with business as usual? And again, a reminder of how many millions of people die every year from air pollution. So when you see an image like this, you say, wow, COVID is a disaster. The shutting down the economy is a disaster. But, oh my God, look at the air pollution and how it has dropped and what amazing health benefits there are. I mean, this is satellite images of nitrogen dioxide looking at in China, January versus February. Look at the change there. Look at the change in Europe, looking at the nitrogen dioxide from last March 2019 to this March, over France especially. United States, March of 2019 compared to March this year. And who would have imagined that all 4 of those mega cities in India would have good air quality? I mean, this is unbelievable, right? So I want to end by asking, at this time, do we really want to uncork the conventional fossil fuel economy when we see the global-wide shutdown of the economy, mostly based on fossil fuel, what it means for air quality and global health? So, do we want to restart that old fossil fuel economy, or do we want to get to clean energy where everyone prospers? And so I think this is where there is a golden opportunity. And right now, there is no room for incremental change. This is where the United Nations is starting something, Build Back Better. I think this is where there's a huge opportunity. And finally, I love this graphic. This is from an op-ed. Why don't we treat climate change like an infectious disease? Because as you know from this class, climate change is a global health emergency. And so we really need action to address it, and we need action at the same level that we're dealing with this current pandemic. And with that, I thank you very much for your attention. There's my Twitter handle. A different version of this talk is on TEDx, and I am open for your questions.
Thank you so much, Dr. Patz, for that lecture. And Emmeline is going to be aggregating questions down from the chat box. I actually wanted to ask you a question while she's getting ready with all of these. What advice do you have for our students here? Some of them are just on the brink of their clinical years, on the brink of clinical rotations, for taking all that we know about health co-benefits and bringing it into the exam room, into their advocacy roles as physicians, and directly affecting our patients. Any suggestions there?
Well, yeah, I mean, I think that clinicians are, they're pivotal in this story, because doctors and nurses are the most trusted professionals in the world, well, at least according to the surveys. So doctors and nurses are respected and trusted. And I think it's really important to communicate that climate change is not an environmental tree hugger issue. It is a health issue. When I gave my TEDx talk, I remember people at the end saying, you know, they congratulated me, and then they said, wow, we didn't realize this was a health issue. And I'm thinking, oh my God, I've been working on this for 25 years, trying to get the message out. And still, most of the public just doesn't see climate change as a health issue. And as a health issue, it will attract more attention and the attention it deserves, number one. I think that doctors can look at multiple levels of action. The first one is to lead by example, and to make sure that their clinics and their hospitals are part of the Green Hospitals movement and the healthcare without harm, treating today's generation without harming the next generation. So lead by example, be engaged, civic engagement with mayors and local communities, and of course being advocates at the national level as well. So I think on a one-on-one doctor-patient exchange, there's a little bit that can happen, but I think it's these other avenues that are really important for doctors and nurses to really step up to, and it's a good opportunity for them.
Thank you. Emmeline?
Thank you so much, Dr. Patz. Some of those numbers are really staggering. You mentioned the health benefits offsetting renewable energy by a quarter to 10 times. Really wild. So we have a few questions here. I wanted to ask one of my own questions, which I don't know if it's too nebulous, but via your lecture, you've demonstrated how the health benefits are clear, the science is clear, the economics are clear and powerful, but yet we live in this political landscape where there's somewhat of an undermining of all of those messages that we're sending out. So what recommendations might you have in engaging in this and really trying to make this effective, particularly when a lot of institutions and the trust within it are challenged at this time?
Yeah, so that's the $64,000 question. And I think that, for one thing, I think the COVID-19 pandemic has woken people up to say, hey, you know, we are in a globalized world, and what happens anywhere in the world can end up in our lap. So number one, that global issues really matter, and that you can't just wall things off and be an isolated country, that Number one, global challenges affect you or us. Secondly, that especially with this pandemic, there's a new embrace of science. Like, oh gosh, science actually matters, and we're in this anti-science politics right now. But I think the pandemic is reminding everyone the value of science and evidence, and that global issues matter. And secondly, the core message that climate change is about our health. That is so important. It's so obvious to us, that been working on this, and most, I think a lot of medical students, it's obvious to them as well. It's obvious, but it's not obvious to the public. It's not obvious to the policymakers. They still look at climate change as a political issue, and it's about the environment, and it's environment versus the economy, which is a false argument. So I think making the argument of it's a health issue and it's a golden opportunity for health and the economy, and that there are some vested interests here, and fossil fuel industry simply cannot be doing what they're doing. They have to turn into energy companies and not just be digging up oil and coal. There's a group that we need to really engage with. Industry and the private sector is hugely interested in this. If you look at investments, nobody's investing in coal. I mean, that's crazy. But there are a lot of investors and a lot of private companies that are saying, the world is going to a low carbon economy. In the United States, do we really want to fall that far behind? So I think there's movement from private sector and local, mayors. I read about the Republican mayor in Texas who required, had some rules about you have to go with wind and solar. That people are not stupid when it comes to saving money. And now that renewables have become so cheap, it's sort of game changing.
Thank you for that. And I think that health framing demonstrates a role as, future health providers, how we can perhaps play a role in stressing that. So we're having more questions come in as you're talking. One of them is from Sianat, and I apologize if I pronounced your name incorrectly, from Emory. And their question is, one of the concerns about the transition to clean energy is that the jobs in fossil fuel sector are frequently unionized and high wage, so pipeline jobs, etc. The argument is that renewable energy jobs are not unionized and lower wage jobs. What are your thoughts about that?
Well, that's a great point, and it sounds like the questioner probably knows more about this than I do. I think it's a great question. There's a lot of restructuring that we need to be thinking about post-COVID, and I think that any kind of whatever is in place as far as jobs may be disrupted. But I'm not an expert in job markets. So other than showing the report that says how many jobs there are, that's a tough question that is beyond my expertise. Sorry.
And that's why we bring people together from a bunch of different disciplines. Mm-hmm. So now we have a question from Natalie at Emory. How do we move to a more vegetarian diet if agriculture itself, including clearing, machinery, fertilizer, is a major driver of greenhouse gas emissions? Are there, quote, greener options for farming so that we can be efficient in a modern way with land use without causing harm to the environment? And I think I would add to that in terms of also ways to empower folks who are working on farms and providing and carrying out these jobs.
Right. I mean, there are so many ways to green the agricultural sector. Again, I work with experts in this. I'm not the expert myself, but you know, from going from annuals to perennials, where you don't have to keep plowing up the crop, and every year, you know, you plant it and it's there for a while, and I'm sorry, I saw the poll flash in my screen there. Okay, so going to perennials, which lay down deeper roots and absorb more CO2. So there's that. There's other innovative food sources like seaweed, and I've seen studies about putting seaweed into the feed for cattle, and that reduces methane. There are, you know, no-till farming. There are so many ways to improve the agricultural sector as far as becoming greener. So I'll just tell you, the experts are, I've seen there's tons of ways that we can be doing this far more efficiently. Getting off of monoculture, getting away from corn. You know, there's some things that, you know, there are really low hanging fruit, no pun intended, because fruits are perennial, right? Okay, but this is where, you know, there are plenty of opportunities. A plant-based diet, you know, if you compare the amount of protein from legumes versus red meat, I think it's about 9 times more energy to get a kilogram of protein from red meat versus from legumes. It's like 9 times as much energy. So plant-based diet is really a way to go for our health and the environment. But from a global perspective, there is a role for livestock. You know, the way we're doing this in rich countries is crazy. You know, the concentrated animal feeding operations is not sustainable. There are all sorts of problems with that. But in poor countries where land may not be suitable for growing crops, you know, goats and sheep can graze and provide milk and cheese. And this is where there is a role for livestock in human nutrition around the world. It's just that the extent that we are overproducing red meat in the wealthy countries is harming the Earth's environment, and it's also harming our own health.
Thank you. So we have time for one more question. So I'm going to combine two. So in our lecture with Dr. Landrigan, he mentioned this idea of restarting right, and you know, as we move forward past COVID, and you would use the words build back better that the UN had referenced. So what are your thoughts about what those next steps might be? And kind of within that question from Lisa Thompson at Emory, she was wondering if there are examples of big industry energy companies branching into clean energy sector. So perhaps, you know, as we're thinking about moving forward, what are some of the thoughts that you have? Are there things that are already happening that we can try to translate and increase in other places as we, you know, take the next steps forward?
Well, I'll say one thing that is happening already. This week, I don't know if you know the bike company Trek Bikes contacted me because they've had a huge spike in bike sales. And part of it is because, you know, unfortunately with COVID, mass transit is going to be going, you know, there's not going to be demand for mass transit for a while. Mass transit used to be a really good thing, but until we have a vaccine, I think people will be avoiding mass transit. And so they're looking for single occupancy vehicles, and bicycles is a single occupancy vehicle. So there may be an increased demand there already is an uptick in biking. The downside of that, of course, I saw an article from San Francisco saying that the commuting traffic will be miserable because no one's going to take the BART. They're all going to jump in their cars. But I do think that I've heard that industry is liking this telecommuting and that there are a lot of jobs that may just stay as telecommuting jobs where they're available. Here we are on this Zoom call, and we're working. You know, we're communicating, we're teaching. So I think that will be a change. So as far as transportation and designing for energy efficient transportation, I think the air pollution pictures and the satellite images and the evidence of how much our current fossil fuel economy really damages health through air quality. I can't help but think that mayors and governors and leaders will take a look at that and realize the health burden and try to shift over. There are some companies that are shifting already. I can't name all of them, but there are companies that are heading to low carbon. But it's an opportunity right now to really seize the moment to understand that big changes can happen when you see how fast they've happened with COVID, and we may as well take advantage of this and build back. You know, I was going to start something hashtag restart smart, you know, but UN is already talking about build back better. So I don't know. I'll leave that up to you to figure out what's the best way to take the message forward.
I love that idea. And thank you so much, Emmeline, for those questions and for all of you who asked them. And I think I want to request one more parting thought for you, Dr. Patz. I've had the pleasure of meeting you at the CUGH conference and of working with you a little bit through the Lancet Climate Countdown. There are, of the 200 or so people who've registered for this series, there's a handful who are faculty, like I am, trying to implement this course and other courses on climate change and health in their curricula at their respective schools. You have been a mentor for so many and have just so generously made yourself available for guidance and support to those of us working in this field. What advice do you have for those of us who are also trying to take on that mentorship role and support our students as they move forward, the other faculty members on these calls?
Well, Rebecca, thank you very much. I appreciate your engagement and appreciate your question. I mean, I think that there's a movement now to require this because this is such a big health issue. There's a move to require this in medical school education. I know that we've just started to require, we've had a, 100,000 million% increase going from zero, because it's infinite, right? Requiring 1 hour in the medical school here, at least 1 hour. I have a 2-credit full elective on climate change and health, but now it's required, you know, at least 1 hour. So I think just pushing forward to recognize this is a big topic that's not going away. To anyone in the health field to recognize the centrality of climate change as a health issue. So I would commend you on pulling together this course and to turn it into a required course eventually, and to keep promoting as you are. And I mean, it's people like you that you know, are going to make this happen. You know, I've been doing this for a while, so I'll let you ramp up the intensity and the frequency of this teaching of climate change as a health issue. So
we're not going to let you go anywhere. But I think we're out of our time now. Thank you for that answer. If you guys will all join me in thanking Dr. Patz for being here with us today for that fabulous lecture. Hopefully you can see all the claps going on in the background there. I am so grateful to you. Stay healthy, take care up there, and I will look forward to seeing you soon, Dr. Patz. Thank you so much.
thank you. And I'm going to have to learn how to put that hand signal up there. That's pretty cool.